Antihypertensive medications by pharmacist Khalid Wadi. 1. Diuretics mechanism: increase excretion of sodium and water from the kidneys, reducing blood volume and pressure. Pharmacological effects: lower blood pressure, improve heart function and heart failure. Examples: thiazide, for example, hydrochlorothiazide, trade name, Diuretics, concentrations, 12.5 mg, 25 mg. Loop diuretics, for example, furosemide, trade name, Lasix, concentrations, 20 mg, 40 mg, 80 mg. Potassium-sparing diuretics, for example, spironolactone. Trade name, aldactone, concentrations, 25 mg, 50 mg, 100 mg. Beta blockers, BB mechanism, block the effects of adrenaline on the heart, slowing heart rate and reducing contraction strength. Pharmacological effects: lower blood pressure, improve angina symptoms, reduce heart attack risk. Examples: atenolol, trade name, Tenormin, concentrations, 25 mg, 50 mg, 100 mg. Metoprolol, trade names, Lopressor, Toprol XL, concentrations, 25 mg, 50 mg, 100 mg, 200 mg. 3. Angiotensin converting enzyme inhibitor ACE inhibitors: Zestril, lisinopril, is used alone or in combination with other medications to treat high blood pressure in adults and children 6 years of age and older. Mechanism: inhibit the conversion of angiotensin I to angiotensin II, leading to vessel dilation and lowered blood pressure. ACE inhibitors work by blocking the angiotensin converting enzyme, ACE, which plays a key role in the renin-angiotensin-aldosterone system, RAAS. This system regulates blood pressure and fluid balance in the body. Pharmacological effects: lower blood pressure, protect kidneys in diabetics, improve heart function. Examples: lisinopril. Trade names, Prinavil, Zestril. Warnings: do not use lisinopril if you are pregnant. It could harm the unborn baby. Stop using this medicine and tell your doctor right away if you become pregnant. You should not use this medicine if you have ever had angioedema. Do not take lisinopril within 36 hours before or after taking medicine that contains sacubitril, such as Entresto. Common side effects: dry cough. A persistent, non-productive cough is a common side effect due to increased bradykinin levels. It may necessitate discontinuation in some patients. Serious side effects: hyperkalemia, elevated potassium levels, which can be dangerous. ACE inhibitors reduce aldosterone, leading to potassium retention. Hypotension, excessive lowering of blood pressure, especially in those who are volume depleted. Angioedema, a rare but serious allergic reaction causing swelling, particularly of the face, lips, and throat, which can obstruct the airway. Concentrations: 2.5 mg, 5 mg, 10 mg, 20 mg, 40 mg. Enalapril. Trade name, Vasotec. Concentrations: 2.5 mg, 5 mg, 10 mg, 20 mg. Ramipril. Available in market by name, Tritus. Concentrations: 2.5 mg, 5 mg, 10 mg. Captopril. Available by name, Capitan. Concentrations: 25 mg, 50 mg. 4. ARBs. Angiotensin II receptor blockers, ARBs mechanism, block the effects of angiotensin II on blood vessels, causing dilation and reduced pressure. Pharmacological effects: lower blood pressure, protect kidneys, improve heart function. Examples: losartan. Trade name, Kazar. Concentrations: 25 mg, 50 mg, 100 mg. Valsartan. Trade name, Diovan. Concentrations: 40 mg, 80 mg, 160 mg, 320 mg. 5. Calcium channel blockers mechanism, block calcium entry into heart and vessel cells, leading to relaxation of vessels and reduced blood pressure. Pharmacological effects: lower blood pressure, alleviate angina. Examples: amlodipine. Trade names, concentrations: 2.5 milligrams, 5 milligrams, 10 milligrams. Diltiazem. Trade names: Cardizem, Tiazac, Dilzem. Diltiazem concentrations: 30 milligrams, 60 milligrams, 90 milligrams, 120 milligrams. 6. Alpha blockers. Mechanism: block the effects of adrenaline on blood vessels, causing dilation and reduced pressure. Pharmacological effects: lower blood pressure, improve urine flow and benign prostatic hyperplasia. Examples: doxazosin, prazosin. Trade name: Cardura, Minipres. Concentrations: 1 mg, 2 mg, 4 mg, 8 mg. 7. Central agonists. Centrally acting agonists, also known as central agonist antihypertensives or central alpha-2 agonists, are a class of medications used to treat high blood pressure, hypertension, by affecting the central nervous system, CNS. These medications act on the alpha-2 adrenergic receptors in the brain, specifically in areas that regulate sympathetic nervous system activity, resulting in reduced blood pressure. Mechanism: act on the central nervous system to decrease nerve signals that increase blood pressure. Pharmacological effects: lower blood pressure. Examples: clonidine, methyldopa, guanfacine, moxonidine. Brand names: Catapress, Capve, also used for ADHD in some cases. ADHD, attention deficit hyperactivity disorder. Aldamate methyldopa. Physiotins moxonidine. Concentrations: 0.1 mg, 0.2 mg, 0.4 mg. 8. Vasodilators. Mechanism: directly relax blood vessels. Pharmacological effects: lower blood pressure. Examples: brand name, apresilene. Concentrations: 10 mg, 25 mg, 50 mg, 100 mg. 9. Renin inhibitors. Direct renin inhibitors. Mechanism: directly inhibit renin, an enzyme involved in the production of angiotensin I, leading to decreased levels of angiotensin II and reduced blood pressure. Pharmacological effects: lower blood pressure, beneficial effects on heart and kidneys. Examples: Tecturna, aliskiren, is used alone or in combination with some medications to treat high blood pressure, hypertension, in people who are at least 6 years old and weigh at least 110 pounds, 50 kilograms. Aliskiren. Brand name, Tecturna. Concentrations: 150 milligrams, 300 milligrams. Aldosterone antagonists. Mechanism: block the action of aldosterone, a hormone that increases sodium and water retention, leading to reduced blood volume and pressure. Pharmacological effects: lower blood pressure, reduce fluid retention, protect the heart and kidneys. Examples: eplerenone. Inspra, eplerenone, is the medication used for treating hypertension and heart failure. It acts as a selective aldosterone receptor antagonist, SARA, reducing blood pressure and fluid retention by blocking aldosterone's effects. Trade name, Inspra. Concentrations: 25 mg, 50 mg. Spironolactone, already mentioned under potassium-sparing diuretics. Trade name, aldactone. These classifications cover a wide range of medications used to treat hypertension, with the appropriate choice depending on the patient's individual condition and any comorbidities. These medications combine two different classes of antihypertensive drugs to enhance effectiveness and improve patient compliance. Combination antihypertensive drugs. Examples: diuretic and ACE inhibitor/ARB combinations. 2. Diuretic and calcium channel blocker combinations. 3. ACE inhibitor/ARB and calcium channel blocker combinations. Examples: 1. Valsartan/amlodipine, Exforge. 2. Olmesartan/amlodipine, Azor. 3. Telmisartan/amlodipine, Twinsta. Four. Beta blocker and diuretic combinations. V beta blocker and calcium channel blocker combinations. Here's a text you can send to my flower. Hey love, we can discuss combinations of antihypertensive medications in the next video. Talk soon. With my best wishes, Escalidwadi.